It's Get Up Mornings. I'm Erica Campbell, and May is Stroke Awareness Month. Did you know that the stroke is the 5th leading cause of death in the U.S. according to the World Health Organization? And 80% of strokes are caused by uncontrolled blood pressure. Here with us today to talk about it is Dr. Katina Kennedy. Dr. Katina is a health educator, certified family nurse practitioner that focuses on primary care medicine, teen and women's health. Good morning, Dr. Katina.
Good morning. Good morning.
How are you?
Great. Glad to be here again with you all.
Absolutely. Absolutely awesome. So let's jump right into it. Listen, John Singleton had a stroke at the hospital before he passed. 15 million worldwide have had a stroke. What happens in the body when a stroke occurs, and why are so many people having them?
So a stroke is basically lack of blood flow to the brain. This can be caused by a blood clot, which is called an ischemic stroke, or bleeding of the brain, which is a hemorrhagic stroke. Uncontrolled hypertension, high blood pressure, smoking, high cholesterol, uncontrolled diabetes, aneurysm, a family history of a stroke are just a few causes that risk factors that can cause a stroke.
Wow. Okay, let's talk about some of the signs and symptoms. It's funny, I saw a picture on the internet and somebody had some socks on. You can tell it was an older man, and it was deep indentations in the top of his calf where the socks were tight. What does that mean when someone has that kind of thing happening?
Yeah, so that's called edema, peripheral edema, which is swelling around his legs and his ankles, and that can be caused by uncontrolled blood pressure. Sometimes we don't have signs and symptoms of uncontrolled hypertension. However, that's just one of the things that may occur when the blood pressure is elevated. But some of the stroke signs and symptoms can be blurred vision, confusion, and headache. And then also we go by the acronym FAST. That's F. You look at the face for any slurred vision, slur, like, the asymmetry
slurred
of
speech.
The face.
Yeah.
And then you got it. And then you have A, which is altered mental status. And then you have S, which is the slurred speech. And then you have T, which is time. Time is important. And then also when it comes to A, that's weakness of the arm. So if you notice that if you encounter someone that has like the asymmetry of the face, the drooping of the face, the weakness of the arms, any slurred speech, you need to get help immediately for them. 911. Time is important because if you get that patient to the ER within 3 hours of having stroke signs and symptoms, you can actually save one's life.
How do you prevent stroke signs and symptoms? Like, what do you need to pay attention to before that?
Knowing your health status. A lot of times, persons don't know their numbers. So going to get your physical exam, knowing that BCB, the big three, blood pressure, cholesterol, and blood sugar, I've talked about before in your show. Those are imperative. Those are foundational to our health. Eating healthy, knowing your numbers, taking medications that's prescribed. So if you do have high blood pressure or high cholesterol, guess what? You have to take those medications. Getting adequate sleep, exercising, and of course, avoiding foods high in sugar and salt as well. And then, of course, getting some me time is important as well.
We are talking to Dr. Katina Kennedy about stroke awareness and prevention today. Where can people get more information on stroke awareness?
Visit the mayoclinic.org. All right, that's mayoclinic.org for more information. Great information on in-depth signs and symptoms. But remember that acronym that I just mentioned, which is FAST. That's right.
Absolutely awesome. And tell us where we can follow you on social media.
On IG, Dr. Katina _Dr. K, YouTube, Dr. Katina, Facebook, and then my website, drkatinakennedy.com.
Awesome. Thank you so much for being with us today.
Thank you, and you all have a great day.
That was Dr. Katina Kennedy about stroke awareness and prevention today for Healthy Ever After. All right, guys, we'll be back with more. It's going to get better and better on Get Up Morning.